Pathology of lungs in small ruminants. Being worked as a veterinary assistant surgeon in a remote village covering six hamlets of villages, whenever I used to go to field for postmortem examination, I have seen only two type of lesions. One is the lesions that are associated with the lungs, either pneumonia or acute respiratory distress syndrome like hemorrhages. Sometime I can able to see hydrothorax, the lesions. And the second thing, the lesions that are associated with digestive system. Why these two systems are mainly involved when compared to other systems? Because the respiratory system is the most vulnerable system for any type of injury. Today, the air is not purified or the air is not good for respiration for human beings. After the introduction of coronavirus, everybody is wearing the mask. But we knew that influenza is there, corona is there, all the viruses are there in the air. All the virus particles are present in the air. But we are not focusing on the sheep and goats or any other animals. The large volume of air is flowing, going in and coming out every time. So the respiratory system from the nose to the lungs is all the parts of the respiratory system is highly vulnerable for any noxious stimuli that are present in the air. Not only the virus, including the bacteria, dust particles, pollen grains, all the things are including causing injury to the system of respiration. Pattern recognition. Here, based on my experience as well as the research experience, one should have an idea of the recognition of what disease it is, what lesion it is. Then here as a veterinarian, we should differentiate from others only by doing proper diagnosis and prognosis. If you diagnose the case properly, you can give the prognosis and also you can interpret the case and you can treat the case accordingly. So here, diagnosis and prognosis are the two major parts of veterinarian for the successful in their field as well as career. Respiratory diseases of small ruminants. Based on the etiology, either bacteria or a virus or a fungus or parasitic or other infectious agents can cause a number of agents causing the respiratory infections. Bacteria include Pasteurellosis, ovine progressive pneumonia, mycoplasmosis, enzootic pneumonia, and caseous lymphadenitis. Viral diseases include PPR, parainfluenza, caprine arthritis encephalitis virus, and blue tongue. Fungal pneumonia, mainly cryptococcosis, conidiobolomycosis, sometimes aspergillosis. Parasitic infection include nasal myiasis and verminous pneumonia. Here, verminous pneumonia mainly caused by Mullerius capillaris and Dictyogalus filarius species. Others, enzootic nasal tumors and ovine pulmonary adenomatosis, otherwise called as Jaxicate. These are the commonly occurring respiratory diseases in small ruminants. When you open the carcass, you will see the lesion. Whether all the things are the lesion or the lesions are something else. Here, whenever you are opening the carcass for postmortem examination, whether it is a normal or abnormal thing. Sometimes at the time of death, you will see certain hemorrhages that are arterified. Sometimes there will be a swelling of the lung or edema. Sometimes there will be a postmortem changes because huge volume of blood that is present in the respiratory system, especially in lungs, you will see the hypostatic congestion that is very common after the death of the animals. Then parasitic lesions, the migratory tracts of various parasites finally come to the lesions of significance. So when you have the opportunity to open the lung, before say it is a lesion, you should rule out whether it is a normal or whether it is an artery fact. whether it is a postmortem changes or it's a parasitic lesion. Here I have picturized a table, the incidence of different pathological lesions in the lungs of small ruminants. You can see the numbers. The emphysema, 35 sheep and 2 goats. Here the major thing is suppurative pneumonia, either caused by Staph aureus, 9 cases, or Streptococcus pneumonia. Fibrinous pneumonia, 10 cases, and interstitial pneumonia, 8 cases. Granulomatous pneumonia, E. coli. Mainly, you will see bronchitis and bronchiolitis. These are the major lesions in the respiratory system of a 1-year study period. Here, distribution of a lesion. By seeing the lung, one can say whether it is a bacterial pneumonia or a fungal pneumonia, or it's a complicated with mixed with bacterial, viral and fungal, or mixed with protozoan infection like that. While describing the lesion, you should have the ability whether the lesion is located focally in a one area, pinpoint area, or it's focally large area, or the lesion is present in a diffuse manner, or the lesion is located in the multifocal areas, or you can find some solitary isolated nodules, or lung is a paired organ. There you can see either it is present in the bilateral or unilateral lesion. Sometimes it is transmural, certain tumors that are spread transmurally. Here you can see the pictures of a lung, normal lung showing the distribution pattern of bronchi and bronchioles. Most of the time, suppurative bronchopneumonia and fibrinous bronchopneumonia, you can see it very clearly. Suppurative bronchopneumonia, you can find the anterior lateral lobe. Why most of the time the anterior lobe is affected? Because of the anatomy, the location, gravitational force, and the immune mechanism. You can find the bronchopneumonia, especially in the anterior ventral lobes of the lungs. Followed by interstitial pneumonia. Here interstitial pneumonia, you can find most of the time the viral cases, viral influenza or a PPR, you can see there will be a interstitial pneumonia because the virus replicating in the interstitial tissue, and you can see the lung is heavier than 2 to 5 times, and you will see the rib impression, and if you palpate, the consistency will be rubbery in consistency. Embolic pneumonia. The source of the emboli may be there in the umbilical abscess, or from the lung abscess, or from the liver abscess, or from vegetative endocarditis. Whenever you are treating the case, if you are not following the dose and dosage regimen properly, or sometimes the sheep and goats owners may themselves, they can treat their animal. In that case, there will be a residual bacteria that are circulating and they are forming localized in any of the organs, resulting in vegetative endocarditis. From there will be a formation of emboli, and these emboli are lodged in the capillaries of the lungs. Here in the lung capillary, lung alveoli, you can see in the embolic pneumonia, around the emboli, there will be a thin rim of raised RBCs, a clear, beautiful red color lesion surrounded. It's slightly higher than the normal surface of the liver, the embolic pneumonia. By seeing the liver itself, you can see whether it is a embolic pneumonia or granulomatous pneumonia or some other type of pneumonia. Here in granulomatous pneumonia, the lung will be most of the time there will be a granuloma formation. If you cut open the lung and palpate the lung, you will see the gritty appearance. Sometimes we can see some of the tumors that are metastasis. Sometimes the primary tumor may be affected with the lungs, or the tumor metastasis from the non-pulmonary primary site. Sometimes you can see the locally extensive diaphragmatic pneumonia. Sometimes verminous parasitic pneumonia. In the diaphragmatic lobe, you can see there will be a parasite and the migratory tract. Aspiration, most of the time you can see one side of the bronchopneumonia. Hypostatic congestion, as everyone knows. Here, based on the distribution of a lesion, based on the appearance of the lesion, based on the color, consistency, you can imagine the disease, whether it may be a bacteria or a viral or a fungal or a protozoal, like that. We can able to differentiate by seeing the lungs. These are the gross pathology of lungs. In the picture A, you can find the anterior lateral lung. There will be a clear area of demarcation between the pale pink normal areas and the consolidated hepatized liver-like consistency of the liver. In the B, you can see the clear, yellowish, raised, and also you can find the abscess in the lungs. In the third C pictures, we can able to identify the lesion associated in multiple areas. The mark is given. You can find the borders. There will be a multifocal areas of distribution of the lesion. The fourth, there will be a pleurisy, and fifth also you can see the pleuritis, the pleural pneumonia. Here, the fibrin deposited and adhesion of the lung over the pleura. Most of the time, this type of pleuropneumonia you can see in mycoplasma. Yes, contagious caprine pleuropneumonia. The respiratory tract in the bronchi and bronchiole, you can see the excess amount of secretions, especially froth in the lungs. This is one of the incidents of slaughterhouse sample, especially in sheep. You can see Jaxicate 9%, MADI 15%, pneumonia is the 72% of the cases. Here they are the collected from the slaughterhouse. They are not the cause of death, but unfortunately they are resulting in the poor production of the meat animals. That's why the pneumonia is more important. Either directly it is causing mortality. In some cases, there won't be any mortality, but you can see the production losses, the performance in the meat yield will be reduced, and also act as a carrier for the young ones and spreading the infection to others. Similar way, in goat also, we can able to see the pneumonia in 80% of the cases. Bacteriology of the studies. Here, the swab taken from the pneumonic lesion. From the swab, ABST was done and the bacteria is isolated by culturing. Here, most of the time, out of 43 samples, E. coli isolated in 20 cases. E. coli is universal, everywhere present. Whenever you are finding pneumonia, one of the cause of pneumonia will be the bacterial pneumonia and E. coli. Few cases, they could able to extract all the things, either Mannheimia hemolytica, Pasteurella multocida, Pseudomonas species, Staphylococcus species, Corynebacterium, and Pasteurella trachelosii, and others. Here, in ABST in vitro studies, most commonly gentamicin is the sensitive for most of the isolates. But in practical sense, if you are using gentamicin, the result will be most of the time, the mortality will be continuing without controllable. Similar way, enrofloxacin also. But here, cefotaxime and ceftriaxone, though it is 2% and 11% isolates are sensitive in vitro, but most of the time, practically, if you use cefotaxime or ceftriaxone, you will get better results in the treating of pneumonia. This is the picture of the interstitial pneumonia. Here you can find, whenever you are opening the thoracic cavity, the lung should be collapsed. If the lungs are not collapsed, means the lungs are infected or inflamed, pneumonic. Here you can see the lungs are not collapsed, and also there will be a rib impression. There will be edematous. There is a heavier lungs than the normal. There will be edematous lung, and you can see the rib impression. So whenever you are opening the carcass, you are seeing the rib impression. That means the lung is edematous, and also you can find the lesions in the lung. Here you can see the interstitial tissue is highly thickened, edematous, and also infiltrating the cells. This interstitial pneumonia is the indicator of viral infection, mainly PPR in uncomplicated cases, and also blue tongue in some cases of parainfluenza. All these viral cases, you will see this type of interstitial pneumonia. And bronchopneumonia. Bronchopneumonia is most common pneumonia among all the pneumonias. Here you can see the aspirated material, or in case of bacterial pneumonia, there is a clear-cut demarcation between the normal and mnemonic area. First thing. Then the color, definitely the color is dark red brown in color. Normal color of the lung is the pale pink, but here you can see the clear differentiation between the normal lung and also the pneumonic lung. If you cut open a piece and put it in a water, definitely the lung will sunk in the water. Here the histopathology picture shows that the lung is completely studded with all the necrotic debris, inflammatory cells, and also there is no air spaces in the lung. Most common pneumonic lesions, here the common diseases that one can encounter in their field are Pesti hepatitis ruminans, commonly called as plague, sheep and goat plague, contagious caprine pleuropneumonia, pox, sheep and goat pox, Jaxicate, otherwise called as ovine pulmonary adenoma, and Maddie Visna, pasteurellosis or manhemiosis, parasitic pneumonia, and bacterial pneumonia. These are the 8 to 9 common diseases one can find in their field. PPR, everybody aware that PPR Indian Perspective released by ICAR last February 2023. There you can find 150 pages of report. Throughout the India, you can identify or you can see the outbreaks and the loss due to PPR for the past 10 years or 20 years. Initially, PPR was first identified in Viluppuram district of Tamil Nadu. After that, there will be a occurrence of outbreak throughout the India. Here, PPR is acute, highly contagious disease of sheep and goats. It's more severe in goats, that too young ones. You can see not only the respiratory system is affected, along with the respiratory system, the alimentary system and lymphoid system is also affected. There will be acute or subacute lesions of the PPR one can see. In uncomplicated cases, only you can see the edema and some amount of hemorrhages, especially interstitial pneumonia. Most of the time, PPR is complicated with the bacteria, manhemiosis. You can find the bronchopneumonia. Here, mucopurulent exudate, bran-like deposits. If you open the oral cavity, you can see the bran-like deposits and foul-smelling halitosis from the mouth. And also, you can find the interstitial pneumonia, most commonly right lobe, anteroventral consolidation. You can see complicated most of the time, as I told, secondary bacteria. When you go for histopathology, you can identify intracytoplasmic and intranuclear inclusion bodies, especially in the epithelial cells and type 2 pneumocytes and syncytial cells. Once the PPR is affected, the flock will be, recovery will be very poor. Most of the time, the mortality rate will be 36 to 90%. If you vaccinate before the monsoon season, yes, definitely you will reduce the losses due to PPR. And second and foremost culprit of causing pneumonia is the contagious caprine pleuropneumonia. Here, the Mycoplasma mycoides subspecies capri causes contagious caprine pleuropneumonia. Strain F36 is most dangerous than other strains. Here, you can see the consolidated with fibrinopurulent exudate on the pleura. Edema is extensive and in interlobular area and pleura. Fibrinous pleuritis and pericarditis along with mastitis and arthritis you can see. You can see typical marbling of the lung. Though the lung is sedimented, you can see there will be admixture of 2 to 3 colors of a lung in a single lobe. That means there will be initially lighter areas, then darker, then consolidated. As that of marble, you can see the appearance of the marbling in the lung. So if you see the marbling of lung, especially with the hard cobblestone appearance marbling, you can identify this may be due to contagious caprine pleuropneumonia. Yes, the third culprit is the pasteurellosis. You can see here the pasteurella most of the time during the transport or whenever there is a sudden rain or a seasonal change, there will be an increase in the humidity. One can find this type of pasteurellosis. Pasteurellosis also you can see the lung will be, you can see there will be edema of the hydrothorax and following there will be a fibrinous deposition and also you can identify the formation of adhesions of the pleura along with the diaphragmatic lung lobes. The cut section clearly shows that there is no fluid, there is no air in the lung, completely packed with all the necrotic debris. Here, the Pasteurella causes the first bacterial bronchopneumonia. The strains commonly Pasteurella multocida, Mannheimia hemolytica, and Biberstenia trichelosii. Here in pasteurellosis, not only lung is affected, it's a toxemic syndrome or causing toxemia or septicemia, where you can just take a blood smear and stain it, or hot blood smear. You can identify a typical pinhead shaped organisms and you can confirm whether the disease is due to pasteurellosis or not. And the second thing, you can see the pinpoint hemorrhages or petechial hemorrhages over the heart, pericardium, and also the similar type of hemorrhages are seen in other organs. So whenever you are seeing the lesion in the lung, then alternatively and again you have to check it for other organs. If you see the lesion on the lung, respiratory system alone, you can rule out few things. But if you are seeing the lesion hemorrhages in the other organs, you have to rule out pasteurellosis. Maddie Visna. Maddie Visna is a chronic viral disease of sheep with worldwide occurrence. It is caused by a small ruminant lentivirus. Its clinical manifestation includes primarily pneumonia, mastitis, and secondarily arthritis and encephalitis. It causes substantial economic losses associated with involuntary culling or death of infected animals. Here, the major obstacles in controlling the diseases are the absence of effective protocol for the early and definitive diagnosis. And second thing, lack of understanding whether the disease is due to horizontal or vertical transmission. Third thing, the long interval infection and also seroconversion. Here, not only you can see the respiratory lesions, pneumonia, and also you can see the nervous signs and also chronic wasting will be there. You can see the grayish and nodules and also septal thickening in the lungs. Most of the time, the lung will be heavier 2 to 5 times than the normal. Here, it's a chronic disease. Less than 2 years, you can't find this type of Maddie Visna. Most of the time, Maddie Visna is associated because of its chronic incubatory period. This disease occurs mostly after 3 to 4 years of age. Then Jacques-Cate ovine pulmonary adenocarcinoma, otherwise called as Jacques-Cate. It's caused by the retrovirus. Mainly, this is transmitted by the droplet infection. Most of the time, it's also chronic disease, 3 to 4 years of age. Here you can see the adenoma, the tumor lesions, especially acinar and papillary pattern in the lung. One can identify the disease by doing wheelbarrow test. Here you can see the beautiful lesions, well demarcated consolidated areas, red grayish discoloration, mainly in the diaphragmatic lobe. Here the pictures, you can see the right lobe or on the left side, you can see the clear area of demarcation between the normal lung pale pink areas with the grayish white nodular areas. Most of the time, these tumors are slightly depressed. Sometimes it is slightly depressed. Sometimes it is slightly higher than the normal surface of the lung. Here you can see in all the areas, there will be a clear-cut demarcation followed by there will be a grayish-white nodular appearance. Here in this case, by gross examination itself, one can identify whether it is a nodule due to tumor or some bacterial nodules. Followed by suppurative pneumonia. Here in suppurative pneumonia, whenever if you are treating the cases for any bacterial infection, if you are not treating, if you are not following the dosage regimen properly due to field issues, definitely that will lead to localization of bacteria in any of the organ, especially in the liver, lung and other organs, leads to suppurative pneumonia. Here you can find the clear-cut white necrotic area followed by separate congestion in the other side. So here you can find the other parts doing normal. Sometimes this may be artifact. Most of the time, whenever the lung is more than 70% is affected, then only the animal will go for death. Before that, the animal lives. If the 40% or 50% of the lung is affected, even then the animal is compensated with the remaining lung lobes with available alveoli. Aspiration pneumonia. Whenever you are drenching any fluid or animal unknowingly aspirated, you can see the aspiration pneumonia. Here anterolateral lobe is affected. It is clear-cut demarcation between the normal and abnormal areas. Here in the aspiration pneumonia, you can find the aspirated materials, feed materials or aspirated debris you can find in the respiratory tract as well as in the bronchi, bronchiole, especially in the lungs. In few cases, sheep and goat pox in the wet form, you can find most of the time in the, not only in the lungs and also in the kidney, you can see the red-brown discolored areas or sometimes white nodular areas present throughout the lungs as well as in the kidney because sheep and pox and goat pox also causing this type of mortality in sheep and goats. Last but most of the time, the fungal pneumonia in chronic cases, the sheep and goat are infected with fungal cases, especially aspergillosis, conidiobolomycosis, or cryptococcosis. You can find this type of lesions. In sheep and goat pox, the incubation period is 6 to 8 days. Mainly, you can identify based on fever or labored breathing, depression, sometimes lacrimation and salivation. Lesions mostly on the muscle and lips. Skin lesions may vary from macule, papule, or vesicle pustule to pock lesions and scab. But the clinical signs of goat pox and sheep pox, you can easily identify. You can identify based on histopathological lesion or gross lesions, reddish to whitish, firm nodules in the mucosa of the larynx and the trachea as well as in the lungs. Here in the fungal pneumonia, most of the time the fungal diseases are aspergillosis, cryptococcosis, conidiobolomycosis. Here you can see the sheep with swollen right nasal region and the granulation tissue. And also you can see there will be hemorrhage in the nostrils. In the second picture, there is a large yellow gelatinous cystic mass in the lung of the goat. Third one, you can see the brain lesion with a bilateral and symmetrical cystic and gelatinous lesion in the corpus striatum. And the fourth one is the histopathology, lung of the sheep with a round to crescentic, lightly stained or non-staining 5 to 20 micrometer diameter yeast you can find. They are the cryptococcosis yeast. So this fungal pneumonia most of the time ignored. Whenever in the animals are slaughtered, they will be cutting all the waste parts and throwing out. In conclusion, the recognition of the pattern is more important. Whether it is a bacteria, virus, or a protozoa is more important. Before that, we have blue tongue. Sometimes blue tongue also find the lesions in the lung. But you can see only the edema and hemorrhages. Sometimes there will be a toxicities. Whenever the animal is allowed for grazing in a nitrate poisoning area or sewage mixed area, you can find there will be a edematous in the lung and also there will be hemorrhages in the lungs. Some cases the animal is purposefully poisoned. In that case, you can see there will be endothelial damage and lesions throughout the body, all over all the internal organs or lesion with hemorrhages, and there will be necrosis and erosion you can see. Similar way, in other diseases also you can find out the cases. Here, in concluding remarks, whenever you have the opportunity to open the carcass, just do the postmortem. First thing, whenever you are doing the postmortem, everybody is having the smartphones. As much as possible, you can collect the photos and you can take the pictures and send it to the reference your seniors or any persons with our experts. You can have an idea. So what disease it is, you can identify and you can collect the sample and you can submit for the further confirmation. Today, the air is completely mixed with all the bacteria, virus, dust, fungus, protozoa, and continuously flowing in the system. So anytime any infection can occur. But based on the acute or severity of the lesion or a chronicity of a lesion, progressive of the lesion, and the pattern of identifying the mortality, whether all of a sudden there will be a outbreak or endemicity, you can identify whether the disease is due to bacterial cause, or sometime it is complicated with a virus, or sometime you can find based on the occupational hazard. Sometime you can see flocks that are grazing under the lead area, and other areas you can find the lesions that are associated in the lung. So mainly you can recognize the pattern whether it is an interstitial pneumonia based on the appearance of the color of the lung, and also consistency, texture, distribution of a lesion, mainly gross lesion. You can have an idea. Morphological diagnosis, based on that you can go for collect the samples and send it to laboratory and confirm the diagnosis. Then meantime you can start treating the flock. Here, based on the experience and studies, though in vitro studies gentamicin and enrofloxacin giving good results of ABST, but practically it is less sensitive when compared to ceftriaxone and cefotaxime sodium.